Thank you so much for joining. We look forward to going through all this with you tonight. And feel free to ask questions at any time. They can be those verbally, or if you prefer, you can just write things to the chat.
Simon, we're hearing you find that your video is still frozen.
Okay, I might turn off my camera then. I apologise, my internet seems to be not wonderful this evening. So if I do freeze it, John might just take over at that point. All right, let me start. So we're going to talk tonight about the clinical governance reporting. And this really covers off an area where pharmacies probably doing it very well in general. And we are in a position where this is going to become more and more important, particularly as full scope expands and broadens to all states and territories, which it will do over the next, certainly the next year or two. So very important that we start to actually make these recordings. And in speaking with the Guild, some of the things they're going to be looking for when the new QCPP is launched in October 2026 will be more along the lines of not showing me what you have, it's showing me what you do. And they're going to want better records or better recording of, take, for example, dispensary incidents. Now, I'm sure none of you, but most people in pharmacies in Australia at the moment sort of scramble around and actually make up some of those in the 2 weeks before their assessment. They might have done them as notes, potentially in Fred, patient notes in Fred, but actually they're useless there because they get lost. So we do need to start recording them in a way that we can have permanent record. We know where to find them. We really need to do it in Fred or any of the other dispense systems. You actually lose that note unless you remember the patient and unless you remember roughly how long ago it was. So encouraging you to do, or to really start getting your teams utilizing the recording mechanisms that there are in terms of the clinical governance. Now, clinical governance is obviously much broader than just recording, and we will be working with another organisation soon to actually do an audit, make an audit available for you in clinical governance, particularly in light of the legislative changes that are going to go through in New South Wales, probably in the next couple of months. Because if we are not looking after our clinical space, which is our pharmacies, certainly the New South Wales Pharmacy Council appears to be a little bit on the warpath on that, and the new legislation actually gives them great powers. So we will be working towards that. Because clinical governance covers things, not just recording, but also things like having your safe locked at all times so that no one else can access it. Having those keys, if it's key safe, kept in a place that's on the person of the pharmacist or in a locked drawer somewhere so no other staff can get into it. And a whole range of other aspects. But tonight we're really going to concentrate on using the new QR forms that we've created for you that you can utilize very simply in your pharmacy, very quickly, easily, without logging in. I'll share my screen and just start to explain them. I'll use the demo pharmacy, but you're going to have the same things. So in pharmacy, in the Hive component, there is a folder. I do apologize for my internet speed. That's called online forms. If you go into that, you will see the different types of forms that are available. And you'll actually see when it comes up, you'll see all of these. There's reporting, dispensary incident, the pharmacy appearance checklist. That's something that QCPP is requiring you to actually be doing on a regular basis within your pharmacy. We recommend at least once a week. And the quality improvement register, we all make quality improvements all the time and just move on. And we don't actually think about it and record it. And that could be something as simple as a waiting chair for your patients. That's a quality improvement because you're giving them a better opportunity to sit down rather than standing waiting for a prescription, for a service, whatever it is. So we've got more broadly in terms of what is a quality improvement. It might be taking on some new software, taking on Pharmacy Hive as a quality improvement for your business. And each time there's a policy update, that's a quality improvement for your business. But you need to just capture those, and it's a very quick and easy way to do this. The service reviews, all your services that you provide, I'm talking vaccination, sleep apnea, even meds checks, etc., are things that you should be reviewing on an annual basis. Welcome, Reese. So, reviews should be occurring on an annual basis of every service. Again, people are getting away at the moment by reviewing one service, giving it evidence to the assessor. And at this stage, you may get away with it. Certainly by the time we get to October next year, that's going to be insufficient. The assessors are going to potentially be looking at all your services or more of your services, that you're reviewing them, that you're making improvements, and documenting all these things. And then the team feedback and notes to the owner are just ways of your team speaking to you, communicating with you for the owners in a way that you might not be there at the time. It might be something they just want to put into writing. It can also be used by owners to actually just write some quick notes, potentially HR notes about team members. So in each of these, and I'm obviously logged into the platform now, and I'll discuss, you can log in and do it, but I'll discuss in a moment how you can not log in and do it. But if you go to the dispensary incident report, a report will come up. Now, if you're in a group, you won't have the opportunity to put the pharmacy code in, and the code is normally the last 4 digits of your phone number. And I'll show you what that looks like on the QR in a minute. Here we go. So in a group, you just get an option to drop down. A quick highlight is coming, and it'll potentially be with us hopefully in the next, and I'll say 4 to 6 weeks, is where we'll actually be producing for each pharmacy their own unique QR codes. So you won't actually put the pharmacy in. You'll actually, your sign that you've got now, you'll actually replace with new ones with be already assigned to your pharmacy, and it just becomes seamless for you. You won't need to put in a code. In this instance, it's 000 or the name of the pharmacy, etc. If you have a look in attachments, you'll find your posters or the cards to actually scan are there. And this is probably the best way to utilize them, is to have these available so that they can just be scanned within the pharmacy. And I'll just show you what this looks like. So it looks like that. So you can put the store code in there, which, as I say, when you get the new ones in the next 2 months, you won't need to do. You may have already one that is the group one, and so you're just choosing your pharmacy out of that group, which obviously makes it a little bit quicker. But as an example, the dispensary incident, if you have this printed and placed in your dispensary area and potentially in your Webster packing area, the pharmacist on duty at the time can just, if there's an error that they want to, or an incident that they want to report very quickly, they can scan that code with their script scanner and have with a browser open, and it'll bring up that same report as I showed you in a moment ago in the platform. It'll bring up this report exactly just in the browser. So there's no need for them to log in, go into Pharmacy Hive, which way. As long as the pharmacy is correct, you'll get that report into the areas that I'll explain in a moment. So my suggestion is that the dispensary incident poster or flyer is up in the dispensary. You could save it so it becomes one of your favorites within that browser. And if you have it in the Webster room or anywhere else that you're doing or having pharmacy dispensing occurring. Things like the incident reports, I'll just go back out. And they all work in the same way. Things like the incident reports. Now that's things like possibly someone's come in and stolen something and you want to report it, something, potentially you've got a patient has fallen over in the pharmacy or hurt themselves, or there's an abusive patient in the pharmacy. It would all be incident reports that you would want to, not dispensary, potentially non-clinical, and you want to capture that data. Now, that data might be important to capture for an insurance claim. It could be a a work health and safety, a WHS incident, one of the staff involved. You might have an abusive customer and you don't record it because you've quietened them down, but your staff member might have, I'll say, mental issues with that, trauma from that particular incident. And if you haven't noted it down, it's very difficult to later be able to go and take, if they're going on workers' comp or anything else. Very difficult for you if you haven't actually made, or someone in you hasn't actually made a recording or reporting of that incident. And against all of these, you've got the same QR code sign against them. So I'll just open another one just to prove the point. In the attachments, to go there, print them out. So something comes the appearance checklist. I normally suggest have it in your staff room. So a staff member can take a phone, be it their own or be it the pharmacy's phone, just scan that QR. Again, don't have to log in at all. They can just go with their phone and walk around the pharmacy and start to note it, obviously putting in the right date, and they start to look at what's there and what's not there. On this particular one, it actually will give you a score at the end, depending on what you find in terms of what each of these buttons has an algorithm score, and so you get a score out of 150 in terms of what each bit. If it's not acceptable because it's not clean, if it's correct, so yes, it's okay, but it's 20 years old and faded, well, that's correct, but it could be better. And invisible. So some pharmacies, I do a lot of traveling around to different pharmacies, and their sign might be obscured, or it might be half peeling. You actually can't even read it. So it's either not acceptable or needs attention, etc. And then there's an opportunity to write some notes. The staff member can just wander around and do all of this effectively on all of these aspects of your pharmacy. What commonly happens is people walk in the back door of their pharmacy in the morning, and they walk out the back door at night, and might not even at the front windows or the front signage. And there might be graffiti, there might be awful from the outside. And unless we purposefully go and do that, we've got no idea what's actually happening outside this. We need to be a bit more purposeful in how we present our clinic. And we've got to start thinking, I think, particularly full scope of our pharmacy as the practice, the whole place, whether it's the front of shop or our dispensary or our consulting rooms, they become the actual practice, the practice of primary healthcare, which is where pharmacies is at the moment. So going in here in the attachments, you'll see that there's a QR for the pharmacy appearance, which again will come up in a second. And there it sits. If we think a little bit further than that, I was talking a little bit before about quality improvement. Again, generally with assessments, people are just going back and thinking, what have we done in the last 12 months or 2 years? If we're capturing these things on the run or at the time, we're going to be far better placed because we can immediately respond to them. We've got a record of them. We can review that register. Because they all drop down into a spreadsheet register. Service review worksheet, I've spoken about that. It's a matter of choosing your service and then going through that service and thinking about how could it be better? So let's say vaccinations or DAAs or whatever, and then you're doing a quick SWOT analysis and you're going through and you're going next into there and you're looking at what improvements could be done. With all these forms, if you've chosen the correct pharmacy, and that's why we're changing it so it's actually going to be pharmacy specific, but right at the moment you still need to choose your own pharmacy or identify your own pharmacy. On the submission button, so when you submit, that report will go to 3 places. The first place is into your QCPP folder. So it'll actually come and go into this folder called Online Form Submissions. And then each of them are listed, and you'll see that there are some examples in here. So each report will sit in here. And it'll capture whatever data has been placed into it. So you've got a full history of what has happened. The second place it'll go will be to yourselves as the owners or the managers or wherever you designate. If you've got it more than one, it'll go as an email. So you as an owner would get it as an email. Some of the head offices have got it going to the head office as well as to the owner of that pharmacy if they're in a group, because the head office is wanting to look at that. Obviously, depending on the structure of your group, you've got to make sure that everyone consents, all the owners consent to that happening. So it goes to those two places, and then the third place is into a register. And in that register, it will then be contained in a spreadsheet, which you then receive as a report on a quarterly basis. And the idea of that is that on a quarterly basis, it's a good idea to sit down with that register, whatever's in it, and you'll see if you recorded nothing, there are going to be incidents every day, every week, in every pharmacy. And so it just depends whether you're recording them or not. But if you're seeing something, you can start to look for trends, and you can actually filter the spreadsheet to say, I want to see every time we've dispensed an expired medicine, every time there's been a DAA mistake, every time there's been a theft, something like that. And you can look for trends, and that way you can look to see, as a quality improvement, how you can overcome that issue. And rather than putting out fires every day and every week solving the same issue again and again, actually go to the root cause of it and do some training with the staff or upskilling them, etc., or take some other preventative methods so you actually reduce the amount of times that these things are occurring. That's the idea of the register, and that's the idea of getting it on a quarterly basis, because you don't need to look at it every day. You should look at the report as soon as it arrives. And obviously, with an email to yourselves, you'll get that as an email and a notification if you've got the app. So I'd encourage everyone to have the app as well. But it really is a paradigm shift for pharmacy. It's a paradigm shift for us to now start thinking about the need to record. And if you speak to PDL would like you to be reporting every incident to PDL. And now that's aspirational, and it's probably ideal, but it's not really going to happen at this point because it's just a little bit, I suppose, hard to do, particularly if you're not using a system like this, which captures everything with one set of documentation, but it takes it to all the places it needs to go in terms of you, the owner, into a repository in the QCPP and into your register. And so try and think of the register not as something for a QCPP assessment. Think of it as a business tool for you to look at a way to improve your business. Reduce errors, reduce the bushfires that you potentially are having to put out on a regular basis. The broader concept with this is we will be bringing out an option on a work health and safety as one of the options, so that you actually are capturing that as a separate incident, because again, there's extra information you might need in that, which you might not capture in a simple form from a normal incident. Because if you've had something occurring and you might be concentrating on the patient or the abusive customer, and you might be disregarding the impact that might have had on your staff member, that needs to be captured if we want to protect ourselves and be able to then go through, if it came to that, something like a workers' compensation situation. These forms, we actually, when I say we're changing to a situation where it's for your pharmacy, the way it's going to come out is actually we're going to group them into, I'll say it, 4 groups, so that you'll go to the same form and you'll choose the type of incident. or the type of recording that you're doing. And we're also going to provide in that way the training as well, so that you can have faster and quicker training recording for people. And what I'm thinking about there is, at the moment, we're getting a lot of assessors asking pharmacists who might have been pharmacists for the last 40 years to prove that they've done training on taking a blood pressure, as an example. So we have a form that's available. It's in trial at the moment. It's about to be launched. It should be launched at the end of this month, where you can actually go as a pharmacist and choose all the different services you might be providing and designate how you were trained in that. Now, that gives you a choice of, it might have been installed by a rep, it might have been a webinar sometime, it might have been at university, it might have been on YouTube. No one can dictate where you get the training as long as it's appropriate training and suitable for purpose. And so, because training doesn't need to be accredited, you'll probably find soon that accreditation on training will fall away. So it's more showing that the training was relevant, and suitable for your particular situation. So that training will be a batch of QRs, and you can choose which training you do. So part of that will be induction in there, but also pharmacist training on services where they can designate how it's happened. And it gives them certificates to confirm that they've been trained in that particular service, which they can store in their staff file, which then becomes evidence for an assessment to say, yes, this has happened. Personally, I'd like us to start seeing QCPP more as this business system that's going to improve our business, rather than an assessment system that we're being tested on. And if we're doing these things, keeping everything up to date and doing, for example, some of these recording and reporting situations, we could have a QCPP assessor walk in any day, as you might be getting at the moment from your state health departments, because they don't tell you when they're coming. They just walk in the door and say, here I am. QCPP is not intending to do this, so please don't suggest that I'm thinking that. But my best case scenario would be every pharmacy in Australia being in a position where a QCPP assessment could occur any day, because they've actually got everything up to date. It's well recorded. They've got all their documentation, everything in order, easy to find, etc. I'm wondering, I know I've been talking for half an hour or so. I'm just wondering, any questions from anyone? Please, happy to answer anything that you might have. And I'll turn my camera on, see if I'm still frozen or if I'm there. I am still here. It's not me as we're recording. So please, if you've got a question, either shout it out or pop it into the chat. Happy to answer.
Seems to have improved, Simon. It's pretty good now.
Oh, good. Thanks, John.
And having said that, he froze. It seems to be better.
Okay, we've got someone asking a question. That's lovely. Thank you. I've been asked, when the forms become specific to each pharmacy, will we be able to customize them? The answer is yes, but depending on what you want, as to whether there would be a cost to your pharmacy. If you want something customized, we would assess that. And if it's an improvement on the form, we'd do it absolutely with pleasure. And we're actually working with a group at the moment specifically on that in particular forms. And we'll put it out to everyone. If you want something that's really very specific for you, there might be a small charge, because obviously there's a build that our tech people need to do in the background for that. Yeah, so the question is to include, for example, store-specific examples of things we record. We use Dragatron Rule and MedAdvisor, so we'd want to include that as the example. Again, My answer would be that we need to have a look at exactly what you're wanting, because it doesn't necessarily matter how you're recording a service. It's more the matter of that you've recorded it. That is important. And so it just depends on, I suppose, the context of what you're requiring.
I've just turned my microphone on to make it easy to explain. More for your incident records and things like that, so that staff don't get confused about what they're trying to classify it out. So if it's a software issue, you'd want to have your list of programs there as opposed to a generalized one. So that's sort of more what I was asking. Working tinker with them, or if it is all behind the scenes, but it sounds like it's on the stage, you guys.
Yeah, so I think so something along those lines would be a relatively simple ad for and potentially useful for everyone, because there's so few providers. As in a Dragatron MedAdvisor, there are not a lot of providers on some of the issues. If you wanted to, if you've got I'm just trying to think of an example now. But if you've got something that's really specific just to your store and probably no other pharmacy in Australia, it would be an issue for, then if you wanted that to happen, absolutely we would do it for you. The charge wouldn't be much, because it actually is probably just adding in a field or two. So, and we'd have a look at that on a case-by-case basis.
Well, it was more, I've already got my own form, so it was more looking at whether we can adjust them to simplify them, because I know the more information that there is involved, the more overwhelmed people are, so the less likely they are out of control
to do it. Yeah, you're right. You're right. And that's where, for example, the dispensary ones, we're looking to split that into different areas, so that there's a DAA component, and with different questions or different options under the DAAs than normal dispensing, if I can put it that way. Plus nursing home work, because that's again a specific area, plus complex compounding.
I'll look out and have a play when back with that.
Yeah, so that's our intention to actually. So you'd go into the dispensary incident reporting form, you'd then choose this was a dispensing issue, and so that you're then just recording, yes, some error on a script, but it might be, if it's complex compounding, there'll be another set of different questions that or options in terms of what happens there. Nursing home, the same thing, and DAAs. So that's the direction we're going in. I suppose, Michelle, we sort of caught in the catch-22 in a sense, because so few pharmacies record anything. We started off wanting to make it in conflict basis at the beginning.
The dynamic form sounds really look forward to trying it out.
Yeah, great. Thank you for that. And yes, so we will be. We've already sort of scoped them out, and we now have got them. We haven't developed them yet. We've got them out in a I'll say a mud map version, and as soon as that then gets approved through the group we're doing testing on, we will then build and then trial and then before we release. Thank you for the question.
Simon, if I can just jump in there quickly, probably if anyone comes up with questions after this around that sort of thing, if you want something done specific to your pharmacy or that may be specific or changed to a form, just get in touch with us by email, book a follow-up session with us, and we can talk through it and work out where we go from there.
Yeah, absolutely. Because essentially, once some of the architecture's in the system, it's quite simple to add. If there's just some part that we want changed or want added, we can potentially do that very simply and quickly for everyone. The other thing, Michelle, which may answer, might have been a question and it might not have been, is we're also looking at it so that you can actually, let's say we do a dispensary incident, we're doing it so that you then get an opportunity to add to that form later, which isn't there now, because you might have a dispensary incident. You might not know if it's going to go to become a PDL issue. You're going to say, you might acknowledge that you're going to inform PDL at the time, but you don't know if it's gone anywhere. And if it does actually go or it doesn't go, you might want to go back to that form and just capture some more information around that particular case. So you can go back to that and say, yeah, look, there's the patient is not taking it further. We've confirmed that with the family, etc. Or it could be, it's now a PDL issue because there's a health complaint, etc. And you can, so those forms will stay together with all the data that you collect for that particular case or for that particular incident. Great. Anyone else got any other questions, thoughts? And I'm happy for anything, that if there's something that you feel that I haven't covered in this part or haven't explained at all or haven't explained well, please, now's an opportunity. Very happy to cover any topic.
I think just bringing questions.
Have.
Can I just ask a verbal question because I can't work out how to type in the chat?
Sure. Please do, Sam.
The task, what's the best way to, if you've got a new policy or an update to a policy, what's the best way to put it out to all your staff to make sure that they've read it and record that they've read it?
Yeah, so if it's two things, I suppose. If it's a specific store policy, I'd be suggesting you put it into QCPP manual somewhere or into the Hive. You could then do it in two ways. You could go and ask them to all approve it.
Yep.
As in the QCPP tab. Or you could give them a task to approve it or to go to read it. If it's we know we've got an issue with tasks where if you assign it to everyone, once one person finishes it, it appears that it's finished. And so you have to create then a subtask for each person underneath that. So in other words, you'd create a top line task. Please read this policy, and you could link it. If it's in the Pharmacy Hive, in the QCPP, you could actually link it in the task text. And then you create a subtask for each person. Now, I know that's manual. I know it's a pain in the neck. Our developers are working on that to create it so that when you do that, you've got an option of either one task you don't care who finishes it, or it's a subtask for each person. And then you can go and have a look, and each person needs to complete their own subtask.
So if we use the approval method, which at the moment we do, is that recorded in a way that a QCPP assessor would be able to show them that this was done that way?
You would be able to show them that. I guess it's a question of whether, depends what they're looking at. They would be able to go there and see that each staff member has approved that form.
Yep.
So when we created that, the approval was sort of saying it was more of someone writing it and someone else approving it, and that's why we used the word approval. So just them getting their heads around the fact that they've done that, the person has actually read that document. Because it doesn't specifically say that. It's not asking them to have read it. It's just asking them to approve it.
And is that date stamped with when they did that?
Yes.
Right. Okay.
Yeah.
The annual
obviously in the
online
task form, you get that a date stamped against each as well, so you can see that in the task as well.
Okay.
When they've completed it, when they've completed the task.
I think I just sent the online annual refresher
Yes.
part thing to people. That looks really good too. So that there's that group of ones that you can batch and everybody has to go through and refresh those.
Yes.
So I thought that was a really good option.
Yeah, and that's again, it'll fall down into that training folder within your within your QCPP so that you can actually get that from each staff member on completion.
Yeah.
So
Thank you.
some others won't be aware of some of that because it's in our trial group at the moment, where the induction, actually most of you should have the induction online, but the annual refresher is becoming an online form like the induction process. So that you can task your staff to go and work through that, and they'll be reading the top sort of 14 policies, sort of the ones, things like privacy, confidentiality, generally around conduct, social media use, and things like that. And it's basically a read, answer some questions, go to the next one, read, answer the questions, 3 questions, and go on. And then it creates them a record of having completed that task and read all those documents. And we're suggesting that becomes something that they are given as an annual task to do, so that there's a refresher. Because some of our people might have been hired 15 years ago and they read the privacy policy then, but they've never read it again. And so this is just a way of annually keeping them up to date. Will the current store codes still be able to be used when the new QR codes are distributed? Yes, they will, but we will be encouraging you to move over to the new format. And it'll be a little bit easier for the team because they don't have to put in a code. They don't have to choose the pharmacy. That's already automatically in there. So it will be a better system. But yes, you will still be able to use the existing for the foreseeable future also. Hey. John's just put a link if you wanted to book a follow-up and have a further conversation or a specific conversation around anything with us. Please utilise that form that is in the chat menu at the moment.
I've just added the email address as well if you want to email us some questions or whatever.
Great. Thanks, John. I'll just show you, and I have got permission to show this. I'm just wondering if I should, though. I have got permission to utilize this as a show, but I haven't got the people blanked out. I haven't got it redacted because it's an online form. Because I just wanted you to get an idea of the register process. Just wonder if I don't go to something that's less. This is an example I will share with you. This is actually an annual policy refresher that Senator was talking to a moment ago. And I'm going to move it so you can't actually read anyone's names. And I'll just share my screen. So this gives you an indication of how the data is then collected. So this is an annual policy review, and it's done. What's hidden further along this tab is the person's name, their pharmacy, and their email address. And this is how they've answered all the questions. And they've accepted the terms and conditions, saying basically they've read this policy and will adhere to it. And so you can actually go through and identify exactly that they've done with each policy and procedure that's in the annual policy refresh, how many times they've tried, and the fact that they've accepted that they will adhere to all of this. So it basically gives you a complete record of what's happened from the staff in particular pharmacies or in your pharmacy, or this is a group look, but in your pharmacy with that particular training exercise of QC of the annual policy refreshers. Any other questions? We welcome not just questions, but suggestions on ways to improve the program and the different tools that are in it. So please don't ever feel shy to offer your suggestions. Give us some of your wisdom, because you're on the ground working with it, and that's the best test and the best use case that we can ask for. So, sorry, John, you were going to say something?
Oh, I was just going to say, I don't know, just while anyone's got any other questions, I don't know if anyone on the call is QCPP only in terms of its subscription level, which means they don't have access to all this. And if there is anyone, would anyone like an explanation of how they can get access to all these online tools, clinical governance tools?
Yeah. If you do, please reach out.
Yeah. Just shoot us an email through the link I put in the chat. You know, you know how to contact us. Just get in touch and we can walk you through that.
Thanks, John. Okay, is everyone comfortable? They know where to find these QRs. They know how to use them now. They know where they go, and hopefully are prepared to go and actually get their teams utilizing them. Thank you for the thumbs up. And I think while I'll just reiterate one last point. While at the moment, most pharmacies are just using QCPP as this exam to pass, that you keep on getting some certain funding. Really, let's try and look at it and things like this reporting as a tool to improve our business and improve how we do things, particularly as we move forward. Otherwise, I'd like to thank you all for joining. It's been a pleasure. I hope that you've all got something out of that. I hope that you're all comfortable to move forward in this direction, and hopefully I've answered your questions. And obviously now got to wait and see. So when we deliver what we've talked about, but I appreciate your time tonight. I know it's precious. I know you've been working all day, so we really do appreciate your time and your engagement with the platform. Thanks very much, everyone. And I'll turn my camera on and say good night. Thank you.
Bye, everyone. Thanks very much.